The test came back on a Thursday afternoon in February. Before the test, before the results, before the phone call from the pediatric endocrinologist, there were 72 hours of a dog who would not move. Biscuit was a 7-year-old Beagle mix. He had been in the Okafor family since he was 8 weeks old, which meant he predated their son Kofi by 4 years and their daughter Amara by 6. He had a specific, settled understanding of his place in the family, beside Kofi during homework, beside Amara during breakfast, and at some point each evening, briefly and with great professional dignity, beside each of them in their beds before returning to his own. He was not a dog who fixed on one person. He fixed on Amara on a Monday morning in February. She was 18 months old. She had been fussy for 3 days, the particular fussiness that parents of toddlers recognize as nonspecific, the kind that doesn't announce a fever or a visible problem, but that doesn't go away. She was eating less, she was drinking more, significantly more, in the way that Nadia Okafor had logged and was planning to mention at the follow-up appointment already scheduled for Friday. Monday morning, Biscuit followed Amara to the high chair and sat beneath it. He sat beneath the high chair through breakfast, which he had never done. The rule was the kitchen boundary, a boundary Biscuit had respected for 7 years. He followed Amara to the playmat. He followed her to the reading corner. When she napped, he lay outside the nursery door in the specific posture of a dog who has appointed himself to a post. Nadia tried moving him twice. He came back. Her husband, Kwame, said, "He's probably just sensing she's unwell." He said it the way parents of toddlers say things that are probably true and possibly insufficient. He called the pediatrician on Tuesday before Friday. "If you stay for stories about what animals sense before we do, you're in the right place. Subscribe so you don't miss the next one." The blood glucose reading at the pediatrician's office was 340 milligrams per deciliter. The normal range in a toddler is 70 to 150. The pediatric endocrinologist who saw them within 2 hours of that reading explained what was happening in Amara's body with the specific care of a doctor who understands that parents of newly diagnosed children are processing shock and need both precision and clarity simultaneously. She explained that type 1 diabetes is an autoimmune condition in which the immune system destroys the insulin-producing cells in the pancreas. She explained that in toddlers, the onset can be rapid and the presenting symptoms can be subtle enough to miss: increased thirst, increased urination, fussiness, fatigue, until the glucose rises to levels that produce more obvious symptoms or, if undetected, to levels that cause diabetic ketoacidosis. She said, "Amara's level when you came in was concerning but manageable." She said, "Another 2 or 3 days without intervention and we would be discussing ketoacidosis." She said, "What made you come in early?" Quaim said. The dog wouldn't leave her side. She looked at them for a moment. She said, "Dogs have documented sensitivity to the chemical compounds associated with blood glucose changes." She said, "Ketones, which begin building before visible symptoms, have a distinctive chemical signature that dogs can detect at extremely low concentrations." She said, "Your dog smelled what was happening to your daughter before her body showed you." She said, "Good dog. Has your dog ever done something that made no sense until it was the only thing that made sense? Tell us in the comments." These stories deserve to be heard. The 72 hours between Monday morning and Thursday afternoon were, in retrospect, Biscuit working in the only language he had. He had no words for glucose. He had no knowledge of endocrinology. He had a chemical signal that told him something was wrong with Amara, and he had used every method available to him: position, persistence, rule-breaking, 72 hours of continuous vigil, to communicate that information to the people who could act on it. Amara was discharged on Saturday with a continuous glucose monitor and an insulin pump, and a care plan and a family who had over the course of 5 days learned more about the endocrine system than they had previously known. Biscuit was at the door when they came home. He did not resume his normal rotation. He stayed with Amara. Every guardian deserves to be recognized, even the ones who never asked for anything in return. If stories like this matter to you, subscribe so you never miss the next one. Nadia started training Biscuit formally 6 months later, a diabetic alert dog program run out of the University of Florida that works with family dogs who show natural detection ability. He completed the program. He is now certified. He wears a red vest. He carries a card. He was going to do what he does whether or not anyone certified him for it. But now, when he sits under Amar's high chair with his specific alert posture, the glucose monitor receives a notification on Nadia's phone as well. 2 systems. 1 dog. The certification was never the important part. Tomorrow, a cat who spent 3 months sitting beside a family member's left side, and what the oncologist's report said about that.